Welcome to True Health Tuesday, and the truth will set you free. So please like this video and subscribe to our channel. It's going to help us grow and spread this vital, life-saving information. Dysautonomia. We're going to go over the causes and the natural solutions. Now, this was inspired by a True Health Tuesday question from Rose Light Cafe. Greetings, Doc. Do you have any thoughts or suggestions for someone with POTS and dysautonomia? My friend has both. She has permanent port in her chest for IV fluids. Her autonomic nervous system is broken. She was in a terrible car crash, big clue, many years ago, and may have been the catalyst for all this. Your thoughts, Doc? You are awesome. Love listening to your videos. Best info ever. God bless you. And that car crash was it. So let's look at what it is. Dysautonomia is an umbrella term for disorders of the autonomic nervous system. Now, this network controls all your involuntary functions: heart rate, blood pressure, digestion, temperature, sweating. When the autonomic nervous system malfunctions, signals can be too weak, too strong, poorly coordinated, leading to widespread variety of symptoms. Now, check out these symptoms. Okay, lightheadedness, near fainting, rapid heartbeat, because the autonomic nervous system controls those functions. Shortness of breath, fatigue, brain fog, difficulty in concentration, temperature intolerance, super common. Abnormal sweating, hyperhidrosis, very, very common. Sleep disturbances, nausea, bloating, constipation, abdominal pain, urgency, vision, everything. And many symptoms are aggravated by changing position, standing, heat, dehydration, illness. According to the National Institute of Health, POTS, postural orthostatic tachycardia syndrome. Anytime you hear syndrome, run, because that means they don't know what causes it. It's one of a group of disorders of orthostatic intolerance as the primary symptom. Now, this describes a condition of excessively reduced volume of blood returning to the heart after an individual goes from laying down to stands up from a laying down position. When we look at this, let's look at the autonomic nervous system. And this is what I tell all my chiropractors that I train, that they are doctors of the autonomic nervous system. Now, it's in two parts. Sympathetic, which is also called thoracolumbar. It's located in the thoracic area in the top of the lumbar. Parasympathetic is located in the brainstem up here and down in the pelvis here. That's why it's called cranial sacral. Now, and this is according to the annual update of intensive care and emergency medicine. Many of the insults that lead to critical illness, such as sepsis, trauma, major surgery, can either cause or be the consequences of profound alterations in the autonomic nervous system. Several cardinal features of chronic critical illness, regardless of the etiology, support the assertion that autonomic dysfunction is a core mechanism underlying the development and perpetuation of multi-organ system failure. By reconsidering the spectrum that autonomic dysfunction encompasses, we explore the pivotal and multifaceted impact exerted by abhorrent autonomic control in critical illness. That nervous system controls and coordinates every function of the body. Now, and I love this. Officially, the cause of dysautonomia is unknown. I mean, come on, guys, go back to anatomy. And at our adaptive physiology site, this is huge. This is where you get to learn these techniques. And this is for everyone. You can see this is the lumbar, the pelvis. Obviously, it's a leaky gut, hip pain, even though her hips are beautiful, bladder problems, sexual dysfunction. She's been to a number of different chiropractors before. Well, I'll tell you what, we're not adjusting the pelvis on her. Now, within the first week, pain decreased 70%. Within 3 weeks, her pain was gone. Within 30 adjustments, we're getting post x-rays. Do you want to learn how to do this? Get on our adaptive physiology site. We go over the adjusting techniques, the anatomy, the physiology, how to reverse the dis-ease process, case studies, employee training, and difficult cases. Look at this guy, 67-year-old male, falls from a truck, massive, massive pain. And because you've got to be very specific, you cannot adjust over those bolts and screws. Do you need help with cases like this? We'll help you. And we also go into business management, employee training, technique training, and this is for doctors and everybody. I teach techniques for moms and dads to help their kids and for spouses to help each other. So get a free account today. Go to theadaptivephysiology.com, create a free account, get exclusive access to our articles and videos. There are many associated conditions with dysautonomia, such as metabolic neuropathies, neurodegenerative diseases. No single disease or condition is directly linked with dysautonomia. No, but trauma is. Dysautonomia isn't a single disease, but it's a set of mechanisms that disrupt autonomic reflex arcs that keep blood pressure, heart rate, temperature, gut, bladder function, everything. The pathogenesis varies by subtypes and generally involves one or more of the following: impaired neural signals, disorder neural humoral control, so we're looking at hormonal issues, end organ receptor dysfunction, so loss of autonomic control or alterations in that control. Key mechanistic patterns of dysautonomia include peripheral autonomic denervation, so there's going to be neuropathic forms, impaired vasoconstriction, so that's closing off, sweating, central autonomic degeneration, Parkinson's, disrupting sympathetic and parasympathetic nuclei. So they don't know what causes it, but they can break it into subtypes. And this is brilliant. Postgraduate medical journal. Impaired innervation of the veins and their response to sympathetic stimulus plays a key role in the pathogenesis of POTS. Now, there's a sympathetic cardiac activation, vasoconstriction, induced in a fall of central venous pressure. Partial dysautonomia can be caused by various stressors and has an immune-mediated pathogenesis. And this is thought to be due to an autonomic imbalance. Just know that when you've got the common carotids come up, and that splits in internal and external, and at that junction, you have two sensors, pressure and carbon dioxide. And so if the pressure drops, this instantly goes down and raises the heart rate. So this is when you're going from laying down to standing up, okay? That heart rate has to increase that pressure. And those sensors tell the heart to function. And the chemo portion of it talks about or measures carbon dioxide levels. So that's how one of the main mechanisms that your body balances pH. So absolutely is a sensor issue. Medications can also cause dysautonomia. And this is all the high blood pressure medications and vasodilators. Diuretics, so the medications you're taking to decrease the volume to increase the kidney function, to decrease the overall volume. Psychotropics, anticholinergic, adrenogenic effects, medications such as opioids, muscle relaxants. And if you figure muscle relaxants are central nervous system toxins, they induce a low blood pressure and decrease autonomic responses. Anti-Parkinson's medications, antidepressants, levodopa. This increases the risk of orthostatic hypertension. Is also one of the balance issues they have. Chemotherapy, neurotoxic agents, other neurotoxic medications, and antimicrobials. You're looking at endocrine and urologic agents, alcohol containing cough and cold medications. And again, at a postgraduate medical journal. Review of all the drugs the patient is taking, drugs which aggravate symptoms of POTS, ACE inhibitors, beta blockers. These are all blood pressure drugs, diuretics, monoamine oxidase inhibitors, antidepressants, phenothiazines. Now, such drugs should be stopped first once the diagnosis is confirmed that the aggravating factors such as dehydration, extreme heat, excessive consumption of alcohol should be avoided. Now, let's just look at the effects. And this says it on the label of ACE inhibitors, blood pressure medication. Feeling like you might pass out. And I tell people, okay, knowing that brain produces or consumes 90% of the body's oxygen, if you slow the blood pressure down, does this slowing the heart rate down, does this increase or decrease blood supply to the brain? Okay, urinating less or not at all, rapid weight gain, fever, chills, symptoms. Remember, these are the effects of the ACE inhibitor blood pressure drugs. Tired, muscle weakness, heartbeats, a pounding or uneven, psoriasis, okay, chest pain, high potassium levels. What are the effects? They call them side effects of beta blockers. Slower, uneven heartbeats. Why? Because the beta blocker is trying to block the sympathetic, the autonomic nerve supply to the heart. Feeling lightheaded and fainting, short of breath, swelling of the ankles, nausea, stomach pain, loss of appetite, dark urine, depression, anxiety. Don't worry, we got medications for that. Cold feeling in your hands and feet, numbness, impotence, sleep problems. Oh my gosh. What are some of the effects of the tricyclic antidepressants? Cardiovascular, looking at increased heart attacks, increased stroke, ECGs going to be abnormal. Okay, heart block, arrhythmias, low blood pressure, orthostatic hypotension, low blood pressure, dizziness, tachycardia, palpitations. What about that central nervous system? Can tricyclic antidepressants negatively affect that? Absolutely. You're looking at coma, seizures, delusions, confusion states, disorientation, ataxia, which is difficulty in walking, movement, tremors, peripheral neuropathies, dyskinesia, dysarthria. I mean, all of these things, nightmares, fatigue. The biggest thing, okay, when you look at this, allopathic questions, you go to a doctor and you say, how can I feel better? What do I got? How do I treat it? What drug or therapy do I take? These are insane. You're not suffering from drug deficiency, but this is the culture we're in. Switch your world, because the quality of your life depends on the quality of questions you ask. Number one thing, what am I toxic with? What am I deficient in? Why do I have the symptom? Why is my body responding this way? That will change your world. Facts that you need to know. Number one, the nervous system controls and coordinates every function of the body, every function. The brain responds to the environment through that nervous system, so based on your perception. DNA or genetic expression is based on your interpretation of the environment. Is it safe or dangerous? You've got physical, chemical, emotional stress will alter that controls your function. If you're in a stress state, okay, you're going to be responding different than if you're in a regenerative state. So you have to look at your stress responses. And now, altering the input to the brain, both structure and function, neuroplasticity, and effectively dealing with stress can reduce or eliminate the disease. You got to deal with the stressors. And luckily, there's only 3 stressors. There's physical, chemical, emotional. The key is your body responds the same to all 3. Now, when we look at how your body breaks down the stress response, the digestive, reproductive, endocrine, all begin to break down from the lack of nutrients and blood flow. The adrenal glands, your primary response to stress, become exhausted. That's adrenal fatigue. Adrenals break down in the first order of endocrine function, followed by the insulin-producing portion of the pancreas, the thyroids, the ovaries, the parathyroid, and the final link in the autonomic nervous system is the hypothalamus. And the hypothalamus gets its input from the position and motion of the vertebrae, from the peripheral nervous system. Now, let's look at stress in the adrenals. What happens under adrenal fatigue? Depression, memory loss, weak immune system, inflammatory conditions, chronic fatigue, confusion, autonomic diseases. So it's not that the adrenals are fatiguing out, it's a chronic state of stress. And then stress in the thyroid. What happens? Obviously, the thyroid, which is, responsible for tissue production. If this it's going to slow down the thyroid. So you're looking at depression, chronic fatigue, fibromyalgia, inflammatory bowel diseases, memory problems, lethargy. So what's the first step? Realizing that your body is under physical, chemical, or emotional stress. Let's break it down. Number one, it's still a censored topic. Avoid wax. Okay, we're looking at injectable products that can trigger multiple issues. If you've gone through the last 4 years in America, you can understand some of that. Medications, find out why you're taking them. Environmental toxins, non-organic, or foods that you're not designed to eat. Now remember, you got a hunter-gatherer body, that's your diet. Nutritional deficiencies, chronic stress. Now let's break it down. The 5 keys to health are the keys to health. Duh. Okay, autonomic nervous system. It's in 2 parts. You can be in the parasympathetic, which is rest and digest. You can be in the sympathetic response, which is fight or flight. If I step on your foot, you're in a stress state. Blood pressure, blood sugar, everything goes up. But also, look at the location in the spine. If you have a physical trauma to that upper neck, you can alter that parasympathetic nervous system. If you have a past trauma that hasn't been resolved, you could be in a sympathetic dominant state. That's why nobody has high blood pressure, nobody has high blood sugar, but they do have a stress response. And to address those autonomic adaptations to that chronic stress without addressing the underlying cause, oh, I'm sorry, that's the American healthcare system. Okay, so health is a healthy adaptive response to the environment. Let's change that narrative. Let's change your verbiage. So does that mean that high cholesterol, high blood pressure, fevers, these are all a healthy response based on stress? To address the stress response without addressing the underlying stress is foolishness. A disease, dis-ease is the way the old chiropractors would write it. It's an unhealthy adaptive response to the environment. Interesting, it's the same responses. Fever, high blood pressure, high cholesterol. So if your body can't respond to the environment correctly, then you're going to be misdiagnosed with those conditions. Then the nervous system, you got to understand, it controls and coordinates every function of the body. Does the nervous system regulate blood pressure and cholesterol and regulate your temperature? Absolutely it does. So an abnormal nervous system response converts to an abnormal adaptive responses. And I love B.J. Palmer. There is no effect without a cause. Chiropractors adjust the causes. Others treat the effects. That is no more evident than now. Now, chiropractors work on a subluxation, which is literally a bone that's misaligned. And this is a great definition. It's a self-perpetuating central motor control problem that involves a joint such as vertebral motor segment. Now, listen to this, and this is huge. It's not moving appropriately. The result is ongoing maladaptive neuroplastic changes that interfere with the central nervous system's ability to self-regulate, self-organize, adapt, repair, and heal. This is essential. That nervous system is encased in this bony structure called the spine, and if that is normal, you have that free flow of information from the body to the brain and the brain to the body. If there is a subluxation, that alters the afferentation or sensory input to the brain, and the brain interprets that information and then puts your body in a stress response or alters the autonomic function. Now, when we look at this, Dr. Chung Hao Su, brilliant. Subluxations can reduce nerve impulses by 60%. Now, do you want 100% information going up to the brain and 100% of that brain's controlled of the body? Yes or yes. I'm going to make it really, really simple. And I love this chiropractic research journal. The removal of the subluxation by a chiropractic adjustment results in improved conduction of the neural impulses. The improvements that were observed are similar to changes seen when neurologic compromise is relieved by surgical procedures to decompress or stabilize the spine. So you got a choice, surgery or chiropractic. I'll take chiropractic, thank you. Okay, and JMPT, Journal of Manipulative and Physiologic Therapeutics. Neuroscience supports research that the neurophysiologic rationale for the concept that apparent stimulation of the spinal or paraspinal structures lead to segmental organized reflex responses of the autonomic nervous system, which may alter visceral function. In English, this means that through that central nervous system that controls the automatic nervous system, if there is a subluxation, it can alter your organ system function. The cool thing is there is a solution. High velocity, low amplitude manipulation of the thoracic, so we're just talking the rib cage area, appears to influence autonomic output to the heart. Why? Because the heart has a sympathetic nervous system at the top of the thoracic area. If you alter the nerves that supply it, you're going to alter that function of the heart. And the parasympathetic supply to the heart is in the upper neck area. Anybody that has heart issues has got to look at the structure. I mean, look at this. You're looking on the picture on the left, which is a more vertical picture where this is more normal. Okay, the person on the right has an abhorrent afferentation or sensory input. Think of this. The position and motion of the vertebrae change the sensory input of the brain, and then that's going to change the brain's interpretation of the environment, and that's going to change the brain's control of the environment. So you can cause or understand depression, anxiety, bipolar disorder, schizophrenia. All of these are features of the frontal lobe. The frontal lobe is programmed by the cerebellum in the back, and that gets its information from the position and motion of the vertebrae. So what are you looking here? You're looking at abhorrent stimulation of that cerebellum, which is going to control the frontal lobe. It's all neurology. When you look at the curve in the neck is called the arc of life. Okay, when you understand that little 1 kilo brain, 2-pound brain burns 90% of the body's oxygen, it does it by creating its own cerebral spinal fluid, the food, okay, and that fluid is supposed to drain through the big hole, foramen magnum, and give nutrients to the spinal cord. If you have a reversal of the curve, and a reversal of the curve only occurs under trauma, it means you damage the posterior longitudinal ligament. This is a trauma, and this is going to interrupt that flow of cerebral spinal fluid, but also you're changing the sensory input from the position and motion of the vertebrae. It's like, duh, you've got to look at the brain has responded correctly based on the stimulus. You've got to look at the structure. Exercise. When you're looking at regular graded exercise is the most effective non-drug therapies for dysautonomia. Why? Because the movement is going to change that sensory input to the brain. Clinically, people often see fewer dizzy spells, less tachycardia, withstanding better exercise tolerance, improved brain fog, fatigue, more stable blood pressure over weeks to months. Yeah, you got to do it every day. According to the Journal of the American College of Cardiology, exercise training increased cardiac size, massive expanded blood volume, that means the heart's working more correctly, improved or even cured POTS syndrome. Wait a second, work in the body helps the brain? I like that. When we look at this, and here's the keys for success, because if you go from laying down to standing, you get dizzy, we've got to do a graduated. Let's start slow. I like that. Start low, go slow, and be consistent. Ideally, you're beginning with recumbent or semi-recumbent work to minimize that rapid change in blood pressure that you require going from sitting to standing. Now, support your body with liberal hydration. If you can get some good, healthy amount of sea salt, a pinch of sea salt in the water will actually help get fluid into the cells, and a long warm up and a cool down. Now, recumbent aerobic training, I totally recommend. It's fantastic. Rowing machine, kickboard with laps, swinging, recumbent bike, and then strength training, focusing in on calves, quads. Why? Because this is going to help blood flow going up. Okay, look at leg press, seated leg press, hamstrings, upright progression. So when you're doing the seated exercises, progress and walk on an incline, elliptical, light jogging. I recommend the short burst where you're walking, fast walking, and then slow walking. Work that up into fast running and for short intervals, and then walking. Yoga, Pilates, amazing because you're moving your body, and that changes the input to the brain. The 12-week ramp is fantastic, particularly if you're not exercising because of pathology. 1 to 4 weeks, do 4 to 5 days, do 10 to 20 minutes. Okay, make it really, really easy. When you're working out, be able to have a conversation. Then 5 to 8 weeks, 25 to 30 minutes. Okay, and know that if you're sore more than an hour, you're pushing it too much. If you're sore less than an hour after the workout, you might want to increase it. So this is a good gauge. Then 9 to 12 weeks, look at 30 to 45 minutes cardio mostly. And I love the interval training where you work really, really hard for 30 seconds to a minute, and then work slow for 1 to 2 minutes or 3 to 5 minutes based on your physiology. The key is hydrate, hydrate, hydrate. Make sure that you're getting water in there, put a little electrolytes in there, a little bit of organic sugar, some salt, and then wear compression. You can wear the compression socks on your legs because typically these people are going to have pelvic injuries, and that pelvic injury is going to alter the parasympathetic nerve supply. You're going to see calf dysfunction. This is why we give calf stretches to every patient. Avoid overheating for sure, because again, you've got an autonomic nervous system dysfunction, and sweating is what cools your body. And I love one of my coaches, okay, said healing occurs up and down on the way up. Okay, so know that you're going to have good times and bad times. And when I tell everyone, you're going to notice the period of good lasts longer, the period of crappy lasts less. Okay, so your body is going to heal up and down on the way up. Now, let's look at proper nutrition. Hugely important. You got to drink 50% of your body weight in ounces a day. 200-pound person, 100 ounces of water minimum. If you're outside sweating, like I'm going to be in a little bit, okay, you got to drink a bit more. And just know that you have got to hydrate. Hugely important. And then you have a hunter-gatherer body. You have 10,000 generations that preceded you. Okay, and what did they eat? They ate organic, free range. If it was preserved, it was sun-dried or fermented. Look at blended fruits, raw dairy, amazing healthy bacteria, reduce the omega-6, increase animal fat, omega-3s. Fermented foods are amazing. This last birthday I had, we had a fermentation party in Bangkok, and that was really kind of fun. But look at kombucha, sauerkraut, pickles, miso, kimchi, and then vitamin D, fantastic. It helps produce serotonin in the brain, increases nerve growth. Okay, so we're talking nervous system disorders. And look at the best areas to get vitamin D3 and omega-3s, anchovy, mackerel, and sardines. Single most important nutrient for brain function. And I love American Heart Association. Our research demonstrates that, but in this instant, demonstrated that postural orthostatic tachycardia syndrome patients have a higher rate of vitamin D3 deficiency. Okay, vitamin D3 levels are lower in more than half of the POTS patients. Obviously, D is hugely important. And magnesium, 80% of all Americans are magnesium deficient. Magnesium is used in over 300 different enzymatic processes. And when you look at calcium, vitamin K2, D is vital. It's got to be balanced with magnesium. What is magnesium necessary for? Muscle and nerve function. What is POTS? It's a nervous system aberrant reaction. Now, what does magnesium do? It creates energy by activating the ADP. Helps digest proteins, fats, carbohydrates, building block for what you need, the RNA and DNA synthesis, precursor to neurotransmitters. Consequences of magnesium deficiency. Check this out. Fatigue, chronic fatigue, weakness, cardiac arrhythmias, anxiety, depression attacks, neurologic disorders. Magnesium is necessary for everything. Now, what's the source of it? Look at this. Let food be your medicine. Brilliant. Dark green leafy vegetables, raw spinach, nuts and seeds, fresh fish, mackerel. Mackerel is one of my favorite fish. Beans and lentils, obviously organic. Whole grains, avocados, banana, dried fruits, cacao. Yes, chocolate. Okay, and if you get the unsweetened, dip the cacao in some raw honey. Oh, my gosh. And then B12 and POTS, according to the Journal of Pediatrics. B12 is involved in the production of adrenaline from noradrenaline. It's a cofactor in catecholamine degradation, plays a role in myelin synthesis. This is the covering of the nervous system. Study concludes that the pathophysiology of POTS, syncope. Our study shows that the association between the idiopathogenesis of POTS and the vitamin B12 deficiency induced Sympathetic nervous system, baroreceptor function. Remember, you've got the carotid that comes up, it splits to internal and external, and you have a baroreceptor or pressure receptor at that junction. And you need B12 for a healthy nervous system function. Where do you get B12? Beef liver, sardines, grass-fed beef, raw cheese, cottage cheese, lamb, raw milk, eggs, wild-caught salmon. Gosh, I'm getting hungry. Okay, now, sufficient sleep, hugely important. Now, look at sleep deprivation, and most people are deprived with sleep. Elevations in cholesterol, blood sugar, reduces blood supply to the gut. These are all autonomic stress responses. Did long-term poor sleep patterns, debilitating physically and mentally, weakens the immune system, higher disease rates. Lack of sleep and dysautonomia. Number one, sleep influences autonomic balance. Shorter fragmented sleep raises sympathetic activity. That means it puts you in a stress state. People with dysautonomia translate into tachycardia. That's speed of the heart. Orthostatic tolerance, worse brain fog, greater fatigue, and sleep loss increases inflammation, which amplifies autonomic reactivity. It puts you in a stress state. What does sufficient state do to dysautonomia? Adequate, consistent sleep improves parasympathetic tone. That is your resting, digesting, and repairing. Remember, when you're sleeping, your body is sleeping correctly, your body is regenerating. Many patients notice fewer pre-syncopal episodes, less postural tachycardia, better stamina when they protect 7 to 9 hours of high-quality sleep and create a regular sleep and wake time. It's hugely important, hugely important. When you're sleeping, you need a dark environment. Get a regular routine. Here's a way to reset your circadian rhythms. Vitally important. Number one, quiet the mind by journaling. And you only write down what you did that day, what you're going to do the next day, and any emotionally charged event. Now, this works on my patients who have Parkinson's and MS. You can't read what they're writing, but the fact they're putting a mark on a paper calms their subconscious. Then read a paper book 15 minutes before bed, no electronic devices. And that rhythmic motion has a calming effect on the brain. Don't read anything exciting, okay? And make it like the book of Numbers out of the Bible or how to assemble a refrigerator, okay? That would be great. Wear nightshades because your brain, you're going to go through these 90-minute cycles called rapid eye movement, where literally when you complete that cycle, your eyes open, then they close. So it has to be so dark you can't see your hand in front of your face. Limit your sleep to 6 hours a night, 10 to 10:30, 4 to 4:30 is excellent. And typically within 5 to 7 days, you're going to be sleeping through the night. And you have to maintain that pattern for 21 days. And for the rest of your life, you look at sleep as the most important part of your lifestyle. So be consistent in your actions. Journal, read, nightshades, bed at 10 to 10:30, out of bed 4 to 4:30 or 5 to 5:30 after 21 days. Prayer and meditation, absolutely vital. Even the CDC states that 85% of diseases are caused by emotions. And if you master your emotions, you change your physiology. Okay, just know that when you have a memory and there's an emotional attachment, that puts you into an autonomic response. Like if you think about something that happened bad to you a week ago and you keep reliving that, your brain starts to get hardwired to that. If you think of something really bad that happened a month ago or a year ago, that constant reinforcement, yet maybe you don't understand, my dog got hit by a truck last week. That's why I'm upset. You don't understand why I'm really upset, okay, this month, because my dog got hit last month. So you keep reliving that event. It then eventually becomes a personality trait if you keep reinforcing that. So the more you reinforce that neural process, those thoughts, those memories, the more your brain gets hardwired. Learn how to reprogram the brain. Meditation is one of the greatest things. And I like the nasal diaphragmatic breathing in through the nose, out through the mouth. And visualize. Visualize moments in your life when your soul smiles. So 10 minutes, 3 times a day, you get a chance to diaphragmatic breathe. but get your brain into the state of visualizing in moments when your soul smiled. Think of when you were 5 years old and your mom gave you a birthday party, or when you were water skiing and you're a teenager, or you're laying on your back looking up and making animals out of the clouds floating by. I mean, any moment. But the more repetition, the more you practice that visualization and the deep breathing and that meditation, the more your brain gets hardwired to joy. And that's why the 5 keys to health are the solution. When the medical system says it's idiopathic, they don't know what causes it, they're not going to present the actual solutions or tell you that your body is adapting correctly based on the stimulus. Check out the drjohnbergman.com. Look at our clinics. We're in Huntington Beach, California. We're in Tijuana, Mexico. And we also have a new clinic in Riverside, California, run with Dr. Danny Mendez. And this is exciting. But check out our website and clinics. Now, please, if you have any questions or comments, post them down below, and we're going to get to as many of those as we possibly can. And please share this vital, life-saving information. God bless you. Understand the world was made for you, and you were made for the world. Stay healthy, my friends.